Hello, and welcome to Week 16 of Health Promotion, Public Policy, Change, and Development. Our objectives for this presentation are to describe health policy as a health promotion strategy, describe policy development as it applies to health promotion, and review the Saskatchewan Tobacco Reduction Strategy as a successful example of health promotion policy. Please view this video on our Health Promotion Policy YouTube playlist following this presentation. A policy, in its simplest terms, is a course of action or inaction chosen by public authorities to address a given problem. Policies shape how money, power, and material resources flow through society and therefore affect the determinants of health. Advocacy and policy are closely linked. According to the Ottawa Charter for Health Promotion policy combines diverse but complementary approaches including legislation, fiscal measures, taxation, and organizational change. It is coordinated action that leads to health, income, and social policies that foster greater equity. Advocating healthy public policies is the most important strategy we can use to act on the determinants of health. One of the areas the Ottawa Charter called for action is to build healthy public policy. This call to action was to ensure that policy developed by all sectors contributes to health promoting conditions, such as healthier choices of goods and services, and the equitable distribution of income. Policy, as a health promotion strategy, strives to make healthy choices easier, to make unhealthy choices more difficult, and to provide equitable access to the social determinants of health. Healthy public policies reduce inequalities in income and wealth, protect people and the earth from toxic pollution, resource depletion, and systemic global effects, create safe, secure, and meaningful work opportunities, create safe, supportive environments in schools, workplaces, and the community. Support the active participation of people significantly affected by a particular policy in discussing, choosing, and implementing the best option. Ensure that individuals and families have access to the recreation opportunities and other programs we need to stay healthy. And finally, healthy public policies should ensure that individuals and families have access to the resources we need to choose and sustain healthy lifestyles. The strengths of policy as a health promotion strategy are that it can address a wide range of health promoting agendas, and it can address complex health challenges through an integrated policy response. By incorporating health impacts into the policy development process, health promotion policy can allow the government to address the key determinants of health in a more systematic manner. Another strength of policy as a health promotion strategy is that it is committed to the achievement of sustainability and the health of both present and future generations. The Health Communication Unit at the Centre for Health Promotion, University of Toronto, states that we should consider policy as a way of sustaining change over time. People in positions of influence may change, but a policy is harder and slower to change. The difficulty in changing a policy can also be a limitation when the policy does not promote health. Other limitations of policy as a health promotion strategy are that it can often be a low priority for health promotion funding compared to healthcare services. It can be challenging to develop health promotion policies that address all the social determinants of health. Finally, the nature of government bureaucracy can be a limitation of policy as a health promotion strategy, as the lack of coordination between ministries and different levels of governments, as well as competition between ministries and different levels of governments, results in a silo mentality that often prevents the development of effective and timely health promotion policy. The THCU roadmap looks at policy development as a linear process. However, you can be at different places on the map at any time. You can start at any point in the process, or move forwards or backwards, or even jump around through the steps as needed. Step 1 is to identify and analyze the problem. Step 2, assess community capacity to determine if a policy is an appropriate strategy. Step 3, develop goals, objectives, and policy options. Step 4, identify decision makers and influencers. Step 5, build support for policy among decision makers. Step 6, write the policy. Step 7, implement the policy. Step 8, finally, evaluate and monitor the policy on an ongoing basis. These steps of policy development can be summarized in the public policy cycle. The key steps in the public policy cycle are identifying issues, setting objectives concerning that issue, setting a policy to achieve that objective, and establishing methods to give effect to that policy. And finally, monitoring the results, which provide a clear logic to plan development. Advocating healthy public policy involves working with others to identify the most important areas where policy can make a difference, finding partners with whom to develop policy options, encouraging public dialogue on policy options, persuading decision makers to adopt the healthiest policy option, and following up to make sure the policy is implemented. In summary, to quote from the Ottawa Charter for Health Promotion, health promotion policy combines legislation, fiscal measures, taxation, and organizational change. Health promotion policies are a coordinated action that lead to health, income, and social policies that promote greater equity. Health promotion policy requires identifying obstacles to the adoption of healthy public policies in non-health sectors, and identifying ways to remove these barriers. Please continue with the Health Promotion Policy playlist for a review of the Saskatchewan Tobacco Reduction Strategy as a successful example of health promotion policy.